Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. I'm delighted that you could be with us today. I got off a plane from South America just a couple days ago. I was operating on children in Peru. Unfortunately, I came back with a little bit of laryngitis. So I'm going to do the best I can and talk about mini lifts during this next and final segment of Your Health television program. First of all, mini lifts. What that implies is that we can affect a limited area of the face or periorbital or eye region with a short incision. There's been a movement, of course, in all areas of surgery in the past few years to do more through smaller incisions. For example, anyone some years ago who had a gallbladder removed would get a pretty long incision in their belly, in their abdomen, and they would have their gallbladder removed through an open approach. Oftentimes that incision would be 8 or 10 or 12 inches or longer. And that way the surgeon could go inside the belly in an open approach to take out the gallbladder. These days, a very high percentage of gallbladders are removed with a laparoscope. 3 very small incisions are made, one in the belly button, a couple others on the surface of the abdomen, and with the use of laparoscopes, modified little telescopes or endoscopes, gallbladders can be removed. Very similar to knee arthroscopy. In the past, people who had a torn anterior cruciate ligament or a problem with a meniscus would have their knee opened up. These days, most knee surgery is done with an arthroscope. Similar procedure. Short incisions are made, arthroscopes, endoscopes are introduced, and that way the inside of the knee can actually undergo an operation through very small incisions. The same thing is true in plastic surgery. For example, it used to be that anyone who underwent a brow and forehead lift would have a very long incision made across the anterior part of the scalp, almost from ear to ear. And that was called a coronal approach. We still do coronal approaches sometimes, but more often a short incision is made in the temple with the hair-bearing part of the skin. 2 or 3 very small incisions are made in the scalp or the junction between the scalp and the forehead, and endoscopes are introduced. That way we can manipulate the muscles in between the eyebrows in the area of the glabella. We can actually lift the eyebrows that way through shorter incisions. And that's another way we can do a mini lift, as opposed to what we used to do, a coronal brow lift where a long incision is made. Now, we're also in an era of plastic surgery where people can have a specific area addressed that they'd like. It used to be that almost anyone who came in for facial rejuvenation would have what's called a full facelift. The neck, jowls, cheeks, brow lift. Oftentimes the eyelids were done in conjunction with the rest of the surgery. These days, a person can just have a specific area affected that they would like to. For example, eyelids only, or a lateral brow lift only, mini cheek lift only, or just the neck. So we can custom design an approach for periorbital rejuvenation, rejuvenation of the forehead, the cheeks, the neck and jowls, and identify or focus on a very specific area with a shorter incision. And that way help a person to achieve the result that they want without much of the downtime. It used to be that a person who underwent a facelift would invariably invariably stay in the hospital. The lower few inches of their scalp would get shaved. They couldn't go out for 6 weeks. Now everybody wants to go on a social function within a few weeks, maybe 2 weeks or so. So that's another advantage of the mini lift, that shorter incisions are made, people have a shorter recovery, and oftentimes we do these things under a local anesthesia or mild oral sedation. Excuse me. So for example, instead of having a full facelift, a person may have a limited incision made in the temple, in the hair-bearing portion of the skin or scalp. We can go down with an endoscope to just identify the lateral brow or the cheek area. I oftentimes do that in conjunction with fat grafting. Fat grafting is a way, for example, to provide volume for different areas of the face or breast or even buttocks. I'll oftentimes do a mid-face lift or elevate the area of the zygoma and combine that with fat grafting to the malar area or cheekbone. If you look at any of the glamour magazines, all the models have pretty high cheekbones and a clean, crisp line around the lateral portion of the orbit. That's what I call the arc of beauty. So we'll oftentimes combine a short incision approach to do a mini lift of the lateral brow and malar area with fat grafting to address just that area that a person wants to address. And again, another way we can do a mini lift is with a short incision for a cheek lift. We can make an incision just under and around the so-called sideburn, whether it's a man or a woman. We can make a shorter incision just in front of the ear within the crease, sometimes under and around the earlobe, and stop there. Through that incision, we can affect a lot of the shape of the cheek. We can elevate the tissues there. And sometimes through that incision, I can sneak down into the neck and do a mini neck lift. So again, not everyone who has facial rejuvenation has to undergo a full face neck lift, forehead lift, brow lift, and eyelids. We can custom design approach just to affect an area that a person is most concerned with. Oftentimes we'll do this under local anesthesia in the office, or with some oral sedation, or under sedation at the surgery center, or even with a general anesthetic at the hospital or surgery center. But the point being is not everyone gets a long incision or a full facelift. Another way we can do mini lifting is by focusing on the neck and jowls. You may have heard about something called the natural neck lift, something that I do as part of my practice quite frequently. The natural neck lift is basically a systematic approach based on what a person wants, a systematic approach based on what they want and their anatomy of the neck, and a custom designed approach is fashioned with the patient to rejuvenate their neck. For example, a person with good skin resilience, not a lot of extra skin that needs to be removed, can often undergo just simple liposuction of the submental area. I make a short incision in the submental crease. I make one incision where one earlobe meets the cheek, and on the other side where the other earlobe meets the cheek. And through those 3 short incisions, I can do liposuction with a cannula. A cannula is essentially a tube that's blunt on the tip with little holes, and the other end is attached to a suction machine. And through that cannula, or with that cannula, we can mold and shape and tailor, selectively remove adipose tissue or fat, and sculpt and mold and shape the submental area, the cervical area, and the neck. That can be very effective for a person who does not have a lot of extra skin, or if their skin is resilient, it can be very effective towards giving them a more improved contour. And of course, a clean, crisp neckline, I think, is highly desirable for both men and women. The next step for a natural neck lift is to look at the skin. Does the skin need to be redraped, tightened, rearranged? If that's true, then we can extend that incision that I previously described for the cheek lift under and around the earlobe into the crease in the back of the ear. Sometimes for a short distance across the bone in back of the ear, that's called the mastoid, and sometimes at the junction of the hair over the mastoid, where the hair-bearing skin meets that bare skin in the back of the ear. That's called the mastoid bone. Through that incision, I can tighten the skin, remove skin, rearrange tissues, and again, a more custom-designed, limited approach can be done simply to address the area that a person would like to change. The next step or progression in a natural neck lift is to look at the platysma muscle. Oftentimes I'll see people come into the office and they'll grab a hold of the tissues under the chin and they say, "Doc, I have so much skin, I want this turkey neck taken care of, I want a wattlectomy." Well, oftentimes it's not just simply skin, it may be a lax platysmal band. The platysma muscle in our species goes from the edge of the mandible down to the clavicles. And that platysma muscle can get lax in the midline and develop what's called platysmal banding. It's really those bands of the platysma, that loose muscle, that can be identified with something called a platysmoplasty. A short curvilinear incision or a short curved incision is made in the submental crease, and that can be done under local anesthesia. I'll oftentimes infuse what's called Hunsted's formula, which is a very dilute local anesthetic, into the tissues of the neck. And that way, we can address the platysma that has become lax and giving the banding under the neck. Oftentimes, the best way to treat a lax platysma is to shore it up, sew it together, sometimes with a pants over vest technique. Sometimes I'll do a short myotomy, which is a division of the banding towards the Adam's apple, and that'll give us a much more clean, crisp neckline as we do proceed with the platysmoplasty to tighten up or reunite the platysma muscle itself. It's interesting to note, I said in our species, the platysma muscle extends from the edge of the mandible to the clavicles. For those of you who are equestrian or horse riders, you may know that in the horse, the platysma muscle extends from that very long mandible about 3/4 of the way down the body, and that's the shivering muscle of the horse. That's the platysma. In our species, or Homo sapiens, the platysma muscle is almost vestigial. It's like the appendix. It really has no other function other than to give the plastic surgeon some work. So the platysma muscle can undergo molding, shaping, and tailoring and tightening up, and we call that a platysmoplasty. So I will oftentimes combine a platysmoplasty with fat removal, whether it's an open lipectomy or suction lipectomy, and oftentimes tightening or redraping the skin from the sides. So the natural neck lift is a way we custom designed our approach to the appearance of the neck and the shape of the neck to give a person more of the contour of the neck and jawline that they deserve. One more step forward is to look at the actual position of the chin in relation to the neck and the facial skeleton. Sometimes people will have a retrusive chin, a very weak chin, and they can be helped by a chin implant, which is a placement of a firm silastic piece on top of the chin, or we can actually oftentimes move the chin or jaw forward. That's called a genioplasty. That can be a very powerful tool in the shaping and tailoring of the whole jawline and neckline as part of the natural neck lift. If you'd like more information about this, I'm Dr. David Morwood. I am a board-certified plastic surgeon. I'm here in Monterey. My number is 831-646-8661. That's 831-646-8661. Or go to my website at drmorwood.com. That's D-R-M-O-R-W-O-O-D, Dr. David Morwood. We've spoken all about mini lifts and the natural neck lift, limited approach to various parts of the face that someone would like to change. Thanks so much for being here today. This is Your Health television program. I'm Dr. David Morwood, a board-certified plastic surgeon. I hope you'll tune in again soon. Thanks so very much for being with us.